Hello, good morning. My name is Tiffany Neal, and today we're going to open up a dialogue on our nursing issue paper regarding the opioid epidemic, discuss some of the barriers and the interventions that we found along the way with researching it. So, I'm going to start off with what topic I decided to choose, and that topic was discussing and researching nurses that are not prepared to care for patients with an opioid addiction and acute pain. Personally, when I graduated nursing school and passed my NCLEX, the day I passed my NCLEX, I was on the floor that night. So I was really thrust upon my nursing journey, and that had a lot of good experiences and a lot of bad experiences. I started that journey in a long term care facility, and the demographics to that facility surrounded a lot of patients that were addicted to opioids but still needed care. Very quickly, I realized I was not prepared to care for a patient with those two analogies. So, in this facility with all of these patients that are addicted to opioids, in long term care, they have a lot of rights, which means they have a lot of visitors, and visitors would bring in narcotics, they would bring in heroin, their drug of choice. And in turn, we had a lot of drug overdoses. And in all this chaos, I really realized my nursing school program and my ADN did not prepare me to care for them. And when you have a patient that is dying and you can fix them and you don't know where to turn to and how to do that other than CPR, it's a big gut check that you weren't prepared in your nursing program to combat this epidemic. I also realized with working with my fellow nurses that had been nurses 20 to 30 years, they too didn't know how to combat this opioid epidemic. And that in itself is a barrier, that lack of knowledge and skills to properly care for these particular patients. Because no matter what, they are patients. They do need care. But we just need to know how to properly care for them with the right skills. And to elaborate a little bit more, it made me also dig through my program that I had just graduated from and say to myself, did we have a curriculum, anything that was devoted to the opioid epidemic? And again, there's a very minor conversation of, the words opioid antagonists or, opioid prescriptions, but there's nothing in there to create skills and knowledge for it. So, let's talk about the opioid epidemic on society, the impact that it's had. It's countless, and I'm sure all of us found many of them. So I'll start off with the opioid epidemic annually is costing the United States over $78 billion. Now, there's multiple factors in that, such as treatment and recovery programs. And again, there are many, many different types of treatment and recovery programs and systems. It also, that 78 billion includes legal fees, our jails, our prisons, going to court, public defenders. So people forget that legal sector, that also impacts because it's illegal to have narcotics that aren't prescribed. And another big chunk of that 78 billion is dedicated to research and development of alternative methods of pain management. And that'll lead me into the different types of interventions, of non-pharmacological interventions that are underutilized and they're harder to use. I did find a wonderful article through Time magazine that focused on Narcan and the opioid antagonists, regardless if it's a name brand or not, its availability and its cost. It was a great article because it was research driven. There was no opinions to it. It was very informative of Narcan and its availability and its cost. So, in the purpose of writing this research paper, myself, when I had that moment of, wow, I'm really not prepared to take care of these types of patients. And last year, 155,000 new registered nurses started their nursing journey. And how many of them were prepared to care for these patients? And with this research paper, it's that figure is very low, unfortunately. Another purpose of this paper was I had a patient that was a dialysis patient, and this was in my long-term care facility. She was found with an absent pulse, and she had shallow breathing, and she had been fine moments before. Nurse practitioner yelled out, "Go get Narcan." And in that moment, as her nurse that needs to save her life, do we have Narcan? Where's it at? And if we have it, how do I use it? How do I give it? And just wasting precious moments. And we did have it, but then I didn't know how to administer it. So now you're a little tiny vial looking at, is it sub-Q, is it IM? And then another level is you have to go find the needle, and all these moments are passing by while this lady, I had no idea that she was overdosing because she wasn't a drug addict. And again, that's another level. You anticipate drug overdosing with patients that are opioid addicted, but not these particular patients. And come to find out, she hadn't been to dialysis for 2 days, and she was taking, an opioid scheduled for chronic pain and not going to dialysis. Her kidneys were chronic kidney failure, and the toxins built up, and she inadvertently overdosed. And thankfully she was saved, but I was very uneducated on the use of it. You know what it does, but you have to give it to your patient. And again, that was a very strong purpose of why I decided to choose that topic. So barriers to our care for patients during the opioid epidemic. Since 1999, we've had a 300% increase in opioid prescriptions. Now, I'm not going to focus on that. That's just the basis of it. When researching to see if naloxone increased, it didn't, which begs the conversation of, well, if you have a 300% increase of something, you need something to combat it. And again, that dialogue wasn't created until many, many years later. That was 21 years ago. And with such an increase in that, you would hope that nursing programs would devote or would progress to a stronger foundation of opioids and understanding this upcoming epidemic. Look where we're at right now with COVID. With this virus, we're at over a million people worldwide that have died from it, yet we have stronger programs and infection control dedicated to it because of a statistic that went up. We have a statistic of opioid prescriptions going up, but we didn't adapt to it as well as we should have. And we're not preparing our nurses to combat it either. I also found in the barriers that nurses, along with communities and citizens, they have a big knowledge gap on using naloxone as well. So intervention information, such as, Narcan's a good intervention, non-pharmacological interventions are a good intervention. In 2018, the U.S. Attorney General's Office issued a public health advisory advising citizens to carry and learn how to use Narcan. Listen, opioid addiction is the least racist thing in the world. It affects everyone. It doesn't matter your color, your size, your gender, your ethnicity, your religion, nothing. Everyone is at risk to develop such an addiction. So with that, since we have people overdosing in every corner of our country, the Attorney General's Office noticed that and implemented that everyone should carry Narcan just in case of those emergencies. I did find a shot that's an opioid antagonist. That's pretty neat. You don't need a prescription. It's auto-loaded and it comes with great directions. However, it's going to cost you $4,290. So pharmaceutical company in that aspect did benefit from the opioid epidemic. But if you have a prescription for Narcan, if you have insurance, it's free. If you do not have insurance, naloxone, which is the generic form of that, is $20 to $40. And if you don't have insurance, or if you don't have insurance and you get Narcan, which is the brand name, it'll cost you about $130 to $140. Because of those statistics, and the person that's solely responsible for that is former President Barack Obama. He created and implemented the Affordable Care Act. that Affordable Care Act has multiple levels of different things that helps the country. But because of that act, he made naloxone affordable and mostly free to citizens and people suffering from opioid addiction. I think Narcan and non-pharmacological interventions are underutilized, and I think that's because of the lack of knowledge and maybe the stigma attached to opioid addiction. We all have been affected by the opioid addiction epidemic in some way, and my heart goes out to you for those. I'm no exception to that. I think we should create and keep creating dialogues on the opioid epidemic and how to care for these patients because they're not going anywhere anytime soon. Thank you very much.